My name is Kathy Lett. I'm an author, a feminist, a campaigner, and of course, the mouth from the South.
And my name is Naomi Strout, and I'm the Executive Officer and Project Manager for the MothersBabies study.
Hi, my name is Professor Imad Elomar. I'm Professor of Medicine at the University of New South Wales. I'm a gastroenterologist and I'm the Director of the Microbiome Research Centre at St George Hospital in Kogarah.
So, Imad, all these people who are in the room who are like keen on quinoa and they're feasting on bone broth and fasting on the paleo or the Atkins, or they're only nibbling organic, non-irradiated, biodynamic, fair trade tofu, is that all a waste of time? I mean, is all the secrets of illness and health contained in our poo?
It's a very interesting
Thank God
question.
you're earthy Aussies, by the way. I mean, I've never discussed poo during lunch, but, you know.
Well, poo gives you kind of an insight into what might be happening in your whole system. Mm-hmm. So we think of poo as kind of waste product, but in fact, it transpires that, in fact, those trillions of bugs that we talked about, Catherine talked about, are not just inert things. They're little factories that metabolize your fiber, metabolize all your waste product, and then feed back things that impact on your health. So yes, poo is important because it gives us an insight in what's going on. And what's absolutely fascinating about this field is the realization that this is something that can be changed towards better health. So I think poo sounds disgusting, especially if you're having lunch. But think of the bigger picture, think of what they can actually tell you about your health, and certainly how you can change it.
So is this just a gut feeling you have about the gut? Or has the science progressed to the point where we know that specific disease signatures are present in a person's poo for conditions like autism, asthma, obesity, etc.?
Yeah, it's a very nice question, Kathy, because essentially we know the broad outlines. So if you have somebody who's healthy, who eats well, you avoid kind of processed foods, you exercise, you're not taking any medications, all of these kind of positive things, there is a picture that is emerging that this is actually a healthy kind of microbiome. Mm-hmm. And if you compare that with something that is associated with disease, there's definitely a difference. Mm-hmm. Now, that is not enough to use as your means of managing disease. It just gives you an idea of understanding why are they different? What is missing? What is needed to replenish this and get you back to that kind of healthy state? And that's where you need to do all the research to understand how you change it back to healthy.
I mean, I left school at 16, so the only examination I've ever passed is my cervical smear test. So I want you to dumb this answer down for someone like me. You say that we owe it to humanity to do this study, and this is the future of preventative medicine. Why?
Now, the reason why is because every now and then you get a new frontier in medicine and science, okay? We've got the genomics, we've got, and these things come, and then people get very excited and worked up, and then very quickly you start to think, we can understand your risk of heart disease or whatever it is. But unfortunately, what tends to happen is that we kind of overshoot and get so much hype, and then we go straight for tests that can predict your risk without actually bringing this back to patients. Now, with this thing, we need to provide that evidence base. We talked about this before, the evidence base that would convince a very conservative profession, which is medicine, that this is the way to go forward. This is what you should be eating, this is what you should be doing to avoid these conditions. This is what is the optimal kind of mix of things that you should be doing. And to do that is incredibly difficult and very time consuming. It's very expensive, it's a lot of hard work. But we owe it to humanity to do all those studies. Otherwise, we're just going to get exactly the same vicious cycle, hype over hype, and then basically disappointment at the end. So, people like us and many others across the globe want to do the proper studies to find the answers that will feed back to the rest of the population of the world.
I mean, I know that this poo testing is available today if you pay for it, but is it too early for these tests to be able to tell us what to do to heal ourselves?
So there's two aspects to this. It's nice to see that there's interest from industry in terms of creating those tests that can predict, your risk of things. The only problem with that is it's kind of jumping the gun a little bit. So it's giving us partial picture. It's not a full picture. It's telling us basically roughly what's going on, but not precise enough to guide your treatment or intervention. So you might end up, you can send these things and get back a readout and then come to my clinic and say, what do I do with this? And I say, I have no idea what to do with this. And I'm the bloody expert. I'm the one that's actually supposed to interpret these things because it's not precise enough. But it's a good start. And I think ultimately when you get all the studies done, you'll be able to rationalize the interventions and then do clinical trials. You've got to do clinical trials. You've got to channel these things through clinical trials so that you can absolutely no debate whatsoever about the value of eating more apples or eating, this type of diet or whatever, then everybody would, I'd be the first to, to follow that. So just give us a little bit of time to confirm these findings in clinical trials so that we can all move forward.
Now, Teresa, I'm sure most mums-to-be are thinking about booties and cute little baby names, etc., not poo samples. How do you think women are going to react to this? I mean, it's kind of off the yuckometer, isn't it?
I know. Why would you add that to the list? But I don't think it's going to be a problem, actually. It's an easy test to collect. We all poo. And it's very easy to carry out. It's not messy. And I think the young women of today are interested in their health and will take part without any problem.
So, Naomi, you can tell us, how will the study actually work for the mums and babies taking part? Can you give us a kind of poo-by-poo breakdown? I mean, how many poo samples are needed from these 4,000 mums and their babies? And where are you going to store them? It's going to give a new twist to the Tupperware party, isn't it?
So I think it's important to note, first off, that the study is actually split into two parts. So there'll be 2,000 women in the initial phase, which is strictly observational, and the second 2,000 will be in that interventional stage once we know what we're actually looking for. It's going to be 22 to 33 months. It's quite a big commitment depending on where the couple are and when they get pregnant during their initial baseline period. Over the course of their actual participation within the study, we'll have 35,000 stool samples alone. That doesn't take into account that there is microbiomes in your mouth. So we'll be taking an oral sample. There's also a microbiome that lives on your skin, and we're going to be taking that as well. We'll also be taking vaginal samples throughout pregnancy and in the postpartum period as well, because we all know that the vaginal microbiome actually impacts on the health outcomes, not only for that mother, but for her child, not just while they're being grown, but throughout their entire life they will be affected by what has happened while they're being pregnant. Now, I would really like to point out, because every woman will think, oh my God, this is another thing that I'm now responsible for, but it's actually, the microbiome is really important for partners as well. In fact, the microbiome of the partner and the sperm and what happens at the time of conception can ultimately impact on the health of that child too. So men out there, it is also up to you to help us out here. We're going to be having a really large recruitment campaign with this as well. MothersBabies, the foundation, is helping us out with that. You'll be able to register via their website if you'd like to take part. The novelty with this study is it is preconception, so we don't have a captive audience like any of the other trials. We can't just go into an antenatal clinic and get people at their booking visit. We want people before they've started to we want people while they're trying to conceive, but we don't want them at the point of conception, because your microbiome does change before you're pregnant and then throughout the different stages of pregnancy. We will then be following you throughout your trimester 1, 2 and 3 checks. Everything that we've done with this study, we have made it easier for you. We want to be able to line this up when you would have your regular antenatal care, and then that way it's not an impact on you and your lifestyle. We'll be taking samples of, like I said, stool, vaginal, skin and oral. There'll also be a bunch of validated questionnaires that we'll also need you to fill out. We want to know what sort of physical activity you do, how much exercise you undertake. Are you on any medications during your pregnancy, and if you are, why? Have you gotten sick? Do you need to take some antibiotics? Are you taking a probiotic? We want to know what you're doing and how this impacts on the health of yourself and your baby. And then in the postnatal period, you're already going to be busy enough. So what we've done as well is we've made sure that we've set up all of your postnatal visits to coincide with your well baby checks. There'll be one at your 1 week visit, then at 6 weeks, and then at your 4 and 6 month visits, and finally at 12 months.
Okay, well, Emad, clearly you're a brainiac. So you've got a serious case of designer genes going on here. But DNA is not the be-all and end-all of disease prevention, is it?
Again, a beautiful question, Kathy. I think people think your genes will determine everything. They're only part of the picture, because to have a genetic heritage can determine a little bit of the risk of a disease. But disease happens because a perfect storm happens. So you need to have a number of things go wrong. Otherwise, the species would have perished ages ago. So you've got to have that component, that interaction between your genes and your environment. For example, the effect of diet. And it looks like the microbiome is what mediates that interaction. So that's the missing link. And that's where I think it's so exciting, because you can, as mentioned already, you can change your microbiome. You cannot change your genes unless it's your Levi.
So are poo transplants the future? And not just for mothers and babies, because when I was researching this, I read about the fact that athletes have a super kind of bacteria in their gut. So you can imagine, Putin putting the poo into Putin by wanting to win gold by changing the kind of dynamic in the gut. Could that actually happen?
Yes. So you could treat certain conditions by doing a transplant from a healthy, normal person to one with a condition. The only problem is that works for simple conditions like C. diff infection, which is a horrible condition, but it's easy to treat. But if you're looking at something complex, you really need to understand what is it in this poo that will help that particular condition. And then the concept of the super donor emerged. And who are the super donors? I mean, in this audience here, there'll probably be some of you who have such high quality poo that it will be an inexhaustible supply and wealth, to be promised.
Thank God you're lawyers and you're used to talking shit, is all I can say.
So athletes actually would be, potentially excellent examples, but athletes who compete at the highest level are very stressed. I don't think you want to take that kind of stressful phenotype into yourself. But don't. I mean, probably the most important, development in the transplant business is going away from an actual, large transplant into what we call crapsulization of the transplant. So basically creating crapsules, and this is the official term, which are much more palatable and certainly much easier to administer.
That's what you're having for dessert. So Naomi, another question for you. As mums, our guilt glands throb all the time, don't they, girls? Should we be eating bone broth and taking probiotics and whatever? Should we feng shui our auras like Gwyneth Paltrow? It's very confusing, but as our very earthy expert, what is your top advice for mums to be?
And look, I would get this question all the time in clinic. People want to know what they can do or what they can take that will help their pregnancy. And I think at the end of the day, you just need to let your common sense prevail. Talk to your GP if you're not feeling well. Talk to your midwife. Get that referral to a gastroenterologist if you think something is going wrong. And get your gut health sorted by an expert. There is a lot of research going into probiotics and prebiotics within pregnancy and child health at the moment, but the evidence just isn't keeping up with the research. So I think in the meantime, what we need to do is studies like MothersBabies. We need to find out what exactly is there before we try and change that. There's no point in looking for an answer if we don't actually know what the question is. Look, at the end of the day, just eat healthy, exercise, really reduce or don't do it all. Things like smoking, drinking, cut down your sugar intake. Enjoy life. Look what we've got out there.
Yeah, relax. Now, Teresa, as our midwife, how is this study different from any other observational or interventional study that's been done on mums and babies before?
Well, this study is really unique because we are seeking women who are planning to be pregnant, and that gives us a baseline for their microbiome. And as the study progresses and we follow these women through pregnancy, they will go into different groups. There are those that will be healthy and there are those that will encounter problems. There are those that will have healthy babies, there are those that will have premature babies, and then babies that will go on to be ill. And we are going to have such rich information, a baseline, that will give us information in the future to look at preventing those disasters and unhappiness. And so, yes, it is a great study. It's not going to be an easy study. It's expensive and we need a lot of participants. But to pinch Imad's byline, we owe it to humanity.
All right. Well, back to you, Imad. Coming from the Shire, I'm more high-tack than high-tech. But for the nerds here today, what are the high-tech aspects of this study? And even, are you going to use any artificial intelligence?
This is a very important and topical question because this kind of study will generate an incredible amount of data. I mean, if you think about, we're outnumbered, by the way. I mean, we're only 1% human. The bugs that we have, all their genes, if you add them up, they're 200 times more than we have. And essentially, to generate those sequences, to tell you who's there and what they're doing, will be an incredible amount of information. And no, current computers are able to do that. But because of artificial intelligence and all the algorithms that are being developed, you'll be able to combine all that amount of data that is coming through and combine it not just with who's there, but what are they doing, what are they producing, what metabolites are being producing, and then try and then relay it back to the patients and their outcomes. So whether it's a healthy outcome or someone with preeclampsia or whatever. So this would be a treasure for anyone who's interested in technology, because it's an incredible challenge, but it's one that is doable. We're seeing such tremendous developments in AI. They'd be able to do this, but we control it. This is not something that is going to control us. We actually control. We control that information that is going into these algorithms to generate the outcomes that would be clinically useful.
I mean, as you guys can see, Emad is a very positive person. He does not think optimism is an eye disease. In your wildest dreams, what do you hope this study will achieve?
Yeah, so wildest dreams suggest that I dream, which suggests that I sleep, and everybody knows I don't sleep. I only sleep a very short period. But what would make me the happiest person on earth is to actually be able to do some good and to leave something behind that is actually useful to humanity. And I honestly and strongly believe that this kind of study, as difficult as it is one that will take us forward. And the greatest satisfaction would be able to uncover the cause of these diseases during pregnancies and prevent them. So if there's a diagnostic test, if there's a little intervention that we validate, that is instituted as a public health policy, and then that leads to a reduction in the disease burden, that's my satisfaction. The transfer of that mother's microbiome appears to be the natural one and the healthy one, and correlates with future health compared to, for example, a cesarean section. But that's on a population level. I don't want anyone that's had a cesarean section to panic here, because it's one little hurdle that you can overcome. But on a population level, yes, a normal vaginal birth, you get all those kind of probiotic type microbiota that live in the vagina, which you then acquire, and then that correlates with better health in the future. But cesarean section is just one aspect. Yes, you start with a little bit of a handicap, but it's not inevitable that you will end up getting disease. It's just being aware of it. Perhaps in the future, you could target interventions that would overcome that particular hurdle. So you're absolutely right, natural birth is better. Same way as the mode of feeding. So breastfeeding is the natural feeding, and the babies get that kind of advantage from both vaginal birth as well as breastfeeding, and gives them a good start in life. Well, Michael, actually, I mean, one of the most exciting bits of the microbiome field is actually that link, the gut-brain axis. And if you look at the science, absolutely fascinating. I'm a gastroenterologist, so I'm used to dealing with tubes full of poo and things like this. But when you actually start reading the science about how your gut impacts on your neuroscience, your brain, it's absolutely amazing. And there's a direct link, because your gut is the most heavily innervated, outside your brain. This is the second largest nervous system. It's the largest endocrine gland, organ. It's the largest immune system, and has a direct wiring to the brain, as well as communication through many little metabolites and other things. So there's absolutely no debate whatsoever about the link between what happens in the gut and diseases like depression, dementia, psychotic illness, schizophrenia, autism, and so forth. So it's happening in the gut, but it's having an impact on your brain. I think that wisdom that we quoted at the beginning of that video about, it all happens in your gut, is actually not an exaggeration. And you can understand why, because you've got all these little factories there that are actually directly impacting on your health, and you're outnumbered. And when you think about it, if you're outnumbered by those cells, every time you go to the toilet, you become a bit more human. If you do a number 2, because you're flushing out quite a big chunk of it. But it has a direct effect on your brain and the way you feel. If you have any kind of disrupted gut function, you're always feeling miserable. If you're constipated, you're miserable. If you've got diarrhea, you're miserable. And it's all now being explained by beautiful science. So it's not an unusual association.
And will the babies need to have the probiotics as well?
Yeah. So wonderful question. Just right at the heart of the matter. Because when we say probiotics or prebiotics, it's just a surrogate marker for intervention of some kind, which has to be personalized. So we're in the business of personalized medicine, because there's no one pill that is going to be. You don't know whether you're missing that bug that we're giving you as a probiotic. You don't know whether it's going to be useful or useless. And that is why this difficult study, will give us a little bit of insight into what is missing in those outcomes. Preeclampsia, preterm labor, gestational diabetes, you can understand the signature better. So then what phase 2 will involve is actually figuring out how you go back to normal, how you replenish those ones that are missing, And it may be in that particular person that you'd give a pill with probiotics in it, or it may be probiotics and prebiotics because they can interact with each other. But think about this, if you just throw in probiotics into a new environment that it's not used to, those bugs go there without a home, for example, will just perish. So this is where that integrated approach, whereby if you want to give probiotics or prebiotics, you've got to have an infrastructure for them. And some people, for example, say that's why you give prebiotics, and it may be that if you increase your fiber and give probiotics, so that is a much more durable and lasting. And it may be that the FMT will teach us something. Maybe that there's not necessarily the poo or the bugs, but certainly the metabolites, something that is being produced that is missing in a particular condition. So it's personalized medicine at the highest level, and this would be difficult, but ultimately the only way of actually making progress. But again, I think obviously if there is a need for taking antibiotics, again, if there's a clinical need, we can't argue with that. But giving it routinely is obviously not a good idea. And I think that's where most of the obstetric practice is moving, is questioning dogma and saying, why the hell do we give antibiotics when we don't need them? So yes, it can have an impact. And even if you have a normal birth, you're a little bit compromised because you've lost potentially some useful, kind of bugs that you could have passed on to the baby. But again, I think, our view is to kind of personalize. So again, if you need it, you need to have it. If not, then obviously try and avoid it.
Well, there you are. Some food for thought on what we eat. As you can see, the only thing I don't eat are my words. But I think, will you join me in thanking our very clever panel?